Nursing is very varied. You can work in a variety of situations. You could be a hospital nurse, or you can be a community nurse. You can work in learning difficulties or mental health, or with children, or be a school nurse. You can even join the military. You could be a cruise nurse, or you can repatriate and work on aeroplanes and bring patients back from other countries once they've fallen ill. There's so many things that you can do within the hospital, so you can work in surgery or orthopaedics or medicine or in the emergency department, or you can specialise in something like cancer care. There's so many roles out there. You can carry on to train. You don't have to work on a ward, or you don't have to become a ward manager. There are nurse specialist jobs or educational roles. There's just so many things that you can do as a nurse. For nurses, patients are our main focus. They are at the heart of everything that we do. Nurses themselves have to be caring. They need to be observant. We are coordinators. We will coordinate many different people around the hospital within that care. So whether we're talking to doctors or physios, or whether we're talking to other nurses, we try and bring all of that together for the patient and their family. So on a good day, you go home feeling like you've done your best, that you've helped someone, that you've made a difference, that maybe we've made somebody better. It may be that we've helped somebody through a tough time. It's a privilege to work with people, especially when they're at their most vulnerable. Obviously, nursing comes with challenges. It comes with lots of challenges, and some days can be an awful lot more or a lot harder to cope with than others. But we have good teams. The camaraderie is really important. The sense of humour that we have to carry us through. We tend to be positive people on the whole. It helps us to deal with things. But obviously there are things that we have to overcome, but working together is really important for that. To become a registered nurse is a degree programme now, so you will need A-levels or equivalent to get into that, but each university is slightly different on their requirements. There are other routes into nursing, so there is the Nurse Associate programme, which is a level 4, I believe, or maybe you would like to be a carer. So as a registered nurse, you're always learning. There's always something new to learn, but there are routes into different types of nursing that will require other training, so you can often go on to complete specialist nursing programs, or maybe a master's or a teaching certificate. There's always something to learn. There's always somewhere to develop. There's lots of career pathways that you can take within nursing itself. So nursing is incredibly rewarding. It's a great place to work. We have great teams to work with. I never wanted to do anything else, so I'm doing what I wanted to do.